Welcome to Navicent Knows Health. I'm Cindy Busby, and I'm here today with Dr. Ashley Jones, general surgeon and also board certified in surgical critical care. And today we're going to talk about her practice right here in Central Georgia. Dr. Jones, thanks so much for being with me.
Thank you for having me today.
Could you let our viewers know a little bit about why you chose medicine and why you chose surgery?
So as a kid, I was always interested in medicine and how the human body works. For me personally, I did not have any physicians in my family, and I was the first person in my family to actually go to college. And so part of it was kind of working my way towards that, thinking that it was something that I wanted to do, but through additional exposures as I got older, really honing in that I did want to do medicine.
Mm-hmm. In your practice in surgical and critical care, you know, that's a specialty inside of surgery. Why did you pick surgical and critical care?
So for me, I like taking care of very sick patients. Mm-hmm. I like knowing that and having the feeling that I've potentially helped save someone's life. Mm-hmm. And so, and that I have the knowledge to be able to care for any problem that comes through the door. Mm-hmm. And that's what kind of drew me to critical care, was being able to help patients no matter how well or sick they are.
When you have a really complex patient, a lot of times you're working directly with families about those
Yes.
care decisions. Can you tell us about how you work with families and communicate with them when you're in the ICU, for example?
Right, so within the ICU, we mostly have surgical as well as trauma patients. Mm-hmm. And so with those families, you very often will have somebody who was well prior to coming in and then now has a life-changing injury. Mm-hmm. And so what we focus on is what our immediate goals in the near future are, mm-hmm. and then what the long-term goals are, and what a person and what their family can expect to happen. And often that involves a multidisciplinary approach involving our physical therapist, mm-hmm. other disciplines, other surgeons, as well as discharge planning, pharmacy. It's a complex thing, and critical to all of that is the family's role and involvement. They also know the patient prior to them coming in, so that when a patient can't speak for themselves, we rely very heavily on the family to help guide us in doing what's correct for that individual person.
You also have a role in training physicians,
Yes.
future physicians. Can you tell us a little bit about how you approach that, having just come out of your fellowship too in the last year?
Correct. So I am newly kind of promoted from the position of being a resident and fellow, and so I am fresh out as far as being able to relate to the residents and other potential fellows. And so the way that I approach it is I try and take the things that I really liked from my attendings during my training and incorporate that into how I teach residents, how I approach dealing with residents. And then I also try to remember things that I wish somebody would have told me sooner, mm-hmm. or not really mistakes, but lessons that I've learned along the way, right. And try and incorporate those in early on to their education, and to try and approach things from a critical thinking aspect and anticipating issues in the future or next steps in an operation, whatever that is, anticipating what else could go wrong, a differential diagnosis. Mm-hmm. And so that's how I like to approach working with the residents, and getting them in early on to being involved in the team approach, making decisions in the OR, and learning the skills, because it's not just the thinking aspect of surgery, you also have the technical aspect of being a surgeon, and so trying to incorporate that in their training early on as possible.
Mm-hmm. When you are doing surgical trauma care, you also have a general surgery practice.
Yes.
Which is the non-emergent, people come to your office seeking consulting about general surgery. Can you tell us a little bit about your area of interest in general surgery?
So within general surgery, most of what I focus on is within is abdominal operations. So mm-hmm. across the nation for general surgeons, most commonly we have a lot of referrals for gallbladder type symptoms. Mm-hmm. I also do endoscopy, so not all surgeons do that. Mm-hmm. Some do, focusing on upper and lower endoscopy, both therapeutic and diagnostic purposes. Mm-hmm. And then always within a general surgery practice for the elective setting are hernia operations. Mm-hmm. And things along those lines.
Mm-hmm. So if a patient watching today knows they might have some of those symptoms, would they just call your office? Is that how referrals come to you?
So referrals can come either directly from the patients themselves. We also have referrals from the emergency room or other physicians, and are always happy to see anybody who has an issue.
Okay, well, thank you so much for being with us today.
Well, thank you for having me. I appreciate it.
And thank you for joining us at Navicent Knows Health. If you'd like to know more about Dr. Jones and her practice, please visit us at navicenthealth.org.